Welcome to Swartz Shorts, the podcast all about the entrepreneurial ecosystem at Carnegie Mellon University and the larger Pittsburgh community.
Welcome back, everyone, to Swartz Shorts. Today on the podcast, we have Matt Polowitz joining us. Super excited to have him here. Matt is an alum of Carnegie Mellon, having gained both his MBA and Master's in Public Policy and Management while he was there. While at Carnegie Mellon, he also co-founded the company Equa. Equa is building better mental health outcomes by personalizing the journey of learning mindfulness. Matt, welcome to the show.
Thanks for having me, guys.
So, Matt, as we always do, before we get into Equa, before Pat hits you with all the hard-hitting stuff.
Hard-hitting questions.
Uh-oh.
Hey, they're coming at you soon enough. But before we get there, we just want to know a little bit more, about who you were before Equa, some of your motivations on, becoming a founder and what led you to this point in time.
Who was I before Equa? Very different person. So my pathway to Carnegie Mellon, it really started in San Francisco. I was working at a startup called Lucid out of Oakland. They were environmental tech. And I was there for a little over 4 years, and it was quite the ride. I was hired on the tail end of this wave of hiring following the Series B. And, they brought in a lot of folks and then sort of changed directions and contracted a bit. So I went through that contraction, a lot of opportunity in that contraction, and I was able to take on a couple different roles there, ultimately becoming a manager in business development, so focusing on like channel sales, mostly partnerships. And then we were acquired, and that was a super fun ride. And I remember how excited I was for the founders, these guys that had put like 12 or 13 years into this company, starting it in college. And, they like got to that point where now they had resources to do a lot more with the company and really like see out their vision in a different way. And I remember just like thinking to myself, like, well, first of all, I put a lot of time into this company. And, I was early in my career. I was having trouble finding that balance of like, not thinking about company when I wasn't at work, but also, I'm like, man, like, I think I could do that, or I think I want that, And so that was one of the things that fueled me to decide to go back to school. I knew sales, and that type of strategic partnerships, thing wasn't necessarily where I wanted to take my career long term. So I definitely wanted, the opportunity that came with getting a graduate degree. But yeah, as soon as I got to CMU, I started feeling out the ecosystem. And I tried a couple different things. Ultimately, that led me to entrepreneurship, or at least reaffirmed that desire in me. And I think, when I thought about it in the past, it was always kind of this like, I will get there. I will start a company one day. And then, there was just this perfect confluence of things that happened with COVID, with where I ended up, out of the recruiting journey, with the opportunity to start Equa sort of falling into my lap, with a connection that I had made early on in my time at CMU. And yeah, that's kind of, all the momentum that brought me to forming the company.
So Matt, in making that decision to form a company, you're in your MBA, you're also getting your master's in public policy, you're busy to say the least, not a ton of time to probably be working on a business on the side, though somehow, some way you found it. What was that journey like? You kind of briefly touched on, recruiting and all of those things, but inevitably, when was that decision made? I'm going to start my own company here in the MBA program.
Yeah, it was an arduous journey filled with a lot of failure. And I say that in like the best way possible, like I think to a degree, all of our failures have brought us to where we are in life. Right. When I came back to school, I was really interested in design thinking, and learning more about, like the culture, the processes, the decisions that are made inside of a business that lead to innovation and lead to these creative, teams that really value ideas maybe over tenure. And so that was sort of like a one thread I was pulling as I was going through my MBA. And one of the things that led me to was this idea of like, oh, maybe I could go work at like an IDEO or a Frog Design and sort of do that type of consulting. And then that kind of led me to, well, I guess I could just maybe follow like the consulting recruiting path and get a job at like a Deloitte or a Bain, one of these companies that also does some of that design work. And so I was sort of like, half in going down the consulting recruiting path, and it was a really cool experience, but I didn't get an offer. And so that sort of put me in a situation where I had to reevaluate. And then, I was sort of starting to lean into entrepreneurship. And what really happened was like, I found a mentor who was willing to put the time in to help me figure out what exactly I wanted to do. And, I met with him for the first time, and, we clicked, and what he told me was like, I'm going to meet with you every week until we figure out what you're doing for your startup. And it was just the most kind, encouraging thing anyone could have said to me at that point, because it's always scary to take that leap, especially if you don't know what you're taking it for yet.
Yeah.
And then, simultaneously, my co-founder reached out to me. I didn't know he'd be my co-founder at the time, but his name is David Cresswell. He's a professor. He runs the Health and Human Performance Lab. So psychology, neuroscience of mindfulness meditation. He's really spent the last 15, 20 years studying what makes people resilient to stress. And I had reached out to him early on in my time in CMU, maybe a month or two in, just knowing about the research that was coming out of CMU focused on the science of meditation. So my background, I started meditating pretty young. I was in high school is when I was really first introduced to it. And, I out of college, I sort of put this workshop together in a class, and I started teaching that. And then that brought me to Asia, where I learned more, and I taught some workshops over there. And in the Bay Area, I did some facilitation as well. And so it's always been this sort of passion of mine. And I was like, I just want to meet this guy who's putting out this research to really further this practice and this philosophy in this field. And so, I met with him, great conversation, not much came of it. I brought him in, we hosted him at Tepper to give a workshop and a session. And then I didn't hear from him for 6 months. And it was just one of those things where all the stars aligned, everything just fell into place. He reached out to me, I don't know, a month after COVID hit. And he was like, hey, I have this idea. I know when we first talked, I didn't really have commercial interests, and that's changed. Here's what's up. Can I bounce some ideas off of you? And one thing led to another, and I decided to make that my summer project. And then, that turned into my fall project, and that turned into me saying, screw it, I'm not recruiting. This is it. I'm going for it.
Yeah. So give us the elevator pitch. What is Equa?
Oh, I actually haven't, we haven't gotten that far yet. So Equa is a mindfulness coach in your pocket. So built on, 15 years of research into the science of meditation. It's really focused on personalizing the journey of mindfulness. I think a lot of these apps out there today are really good in drawing people in. They have a lot of partnerships, you can have Matthew McConaughey read you a bedtime story. LeBron can give you a pep talk. But they're not as focused on curriculum. And they're also one way, right? So you can imagine 3 minutes into a session, you're sitting there and it's telling you should be breathing. And you're like, well, what does that mean? What am I supposed to be feeling? And, maybe you start getting sleepy. Maybe you start getting agitated because you're being asked to sit still and that's uncomfortable. Or you're being asked to do this thing that you're confused by. And all of those things lead to disillusionment, right? You're not really getting it, and therefore you're not going to continue because you're not seeing the inherent value in it. So our whole approach is a more interactive curriculum where we're asking our users questions. They're engaging with their phones while they're using it. They're not looking at their phones, but they're haptically engaging. And we're starting to take them different pathways as we're figuring out like what's working for them, what's not, how they're reacting to the curriculum.
Mm-hmm. Mm-hmm. Love that. And as someone who cannot sit still and also has not been able to use one of those mainstream apps for more than a day, sounds very exciting. So tell us, what does a more mindful company of employees or a more mindful set of students or a more mindful community look like? If the entire city of Pittsburgh is using the Equa app, what changes?
Yeah, I mean, that's a great question. I will tell you, I also have trouble sitting still, and I teach mindfulness, right? And it's funny because I think the people who maybe struggle with it the most, like, they're the future teachers. I will tell you that. I think a more mindful community, like, let's just start on the individual level, right? Like, height of the pandemic, CDC was releasing data saying that 1 in 6 people between the ages of 25 and 44 had seriously considered suicide in the past 30 days. That's insane, right? Wild. And it was like 1 in 4 for 18 to 24-year-olds, right? So I think, like, let's start there, you know? Like, we're all experiencing pandemic fatigue, like this low-grade PTSD from what's been going on over the past couple of years. And, you know, to me, like, there's just an element of how you're responding to this isolation, you know? Like, these inputs are challenging to deal with. And, you know, similar to like an athlete pushing through some intense training, or to, you know, someone with rheumatoid arthritis dealing with chronic pain, like, these inputs are challenging to navigate and they hurt. And a lot of that has to do with how you're responding to them. And so I think, like, you know, individual level, it's like, how are you reacting versus responding to these inputs? You know, Equa is short for equanimity. I don't know if you guys know what that means. Probably not. It's a big word. Don't. It's tough.
That's a bigger word than my normal vocabulary.
You're challenging our intelligence here, man. Come on.
Rightfully.
No, what does it mean? What does it mean?
So equanimity is really your ability to sit through adversity with a sense of calm. Right? So it's like the resilience muscle. And the irony about mindfulness training is that it's uncomfortable. You know, like, I think a lot of people look at it as like this, oh, I'm going to go relax. But then the minute you don't have your phone in your hand, or you're not like reading something or looking at a video or whatever, your mind starts to race, and it's actually not that relaxing. And, you know, there's this concept that, like, you are not your thoughts, you know, like, you can separate from that and you can watch the thoughts go by. Like, you don't have to like be totally wrapped up in that. And equanimity is the skill of like learning how to do that. So, you know, zoom out. What does a mindful community look like? I mean, you know, people who feel free to be creative, people who, you know, are maybe a little bit more thoughtful about how they're interacting with each other. Have either of you ever had the experience of working on a team where you come together and like time flies by and you just get that thing done?
Yeah, Matt, that's the Sword Shorts podcast in a nutshell.
Right? It flies by. It's fun, right?
It is.
Like, you know, if I think of like when I played soccer, or when I'm playing with my band, you know, and there's those moments where you're just connecting, like, I mean, I think that's like the peak that we're all striving for, but there's a lot in between, you know, where we might be on like a down day and that can involve the practice of mindfulness and just sort of helping things maybe flow by a little easier, you know?
So Matt, you know, before the show, we've had the opportunity to talk about, you know, where this app can be used, where mindfulness really can be used, but Equa specifically. And, you know, we've talked about consumers using it, as Pat mentioned, communities and how it can change it. But, you know, we've talked a lot about like workforces and companies, you know, adopting Equa as a solution to motivation or whatever, you know, really is going to be driving it, the company forward from an empathetic, you know, standpoint. What do you think some of the best use cases are for, you know, major corporations to use an app like Equa?
Yeah, so right now we're really hyper-focused on the healthcare space. So, you know, think of like physicians, nurses, clinical staff. They're insanely overburdened right now. And, right now we're selling a 14-day program. We have more than that, but like this 14-day program is like for a physician who doesn't have any time, there's a finite start and end to it. And it's something that they can concretely do to go learn some skills to not only internalize, but also start to give to their patients and teach to the people that they're encountering throughout the day. And then you think of, all these groups that have like low acuity behavioral health issues. So, what is the cost of that on like the healthcare system? Are there geographically spread out, patient populations that maybe can't go access therapists because they just live in hard to reach places? Or, it's really costly because there's a lot of people who need that and there's not enough therapists to go around. There's a huge demand. Think of like, groups below the poverty line that may not have health insurance, right? There's a group that we call frequent flyers, right? So these are groups that get most of their healthcare needs met, like through the ER emergency services department. So they might visit the ER like 8 to 12 times a year for issues that are just like, not what you want to be going to the ER for. And who takes on that cost, right? So if you can start to target some of the costs that are associated with mental health through a solution like this, through an intervention like this, maybe you cut down the visits by like 1 or 2 per year, but how many thousands of dollars is that saving the healthcare provider? Mm-hmm. So those are the types of, interventions that we're thinking about.
Matt, I can tell your passion for the mission of Equa just in the way that you answer these questions. How can we in our audience help you to further the mission of Equa?
Yeah, I mean, first of all, try it out. You can go to our website and submit a form if you do want to check it out, and we can get you into the app. It's not open to the general public yet, but it will be. You can tell a friend about us. That always helps. Follow us on like Instagram, LinkedIn. Still getting the social media stuff set up. I'm not as good as that. But also, we're always looking for introductions to new potential clients. Maybe it's a business leader who is thinking about how they can maximize the potential of their own employees or give their own employees some support. Maybe it's a healthcare provider that, is interested in giving this to their, their physicians, their nurses, or their patient populations. And finally, we're hiring. We're looking for a senior developer, and we're also looking for a designer. So if you know anyone out there that's interested in the space, we really care about people who are passionate about what we're doing and can get behind the mission. Send them our way. We'd love to meet them.
Awesome.
All right, Matt. So on a separate note, your personal life, if you have one, we hope you do. Mindfulness, everything. Entrepreneurship can get busy, but we know you've got a personal life in there somewhere. What are you reading? What are you doing? What are you watching?
Yeah, that's a good question. So there's a podcast, Peter Attia Drive. You familiar with that? My co-founder introduced it to me. There's a great one with James Clear, who wrote Atomic Habits. And, I think a big aspect of like what Equa is always trying to figure out is like how we can help our users build habits. And I highly recommend going and checking that episode out. It's super fun. Anyone who's trying to incorporate something new into their life or trying to remove something from their life, it's a great place to start.
We can try and link that in the description below. So if you're watching on YouTube or Apple Podcasts, just take a look in the info, and we'll link that podcast episode down there.
Perfect. Matt, thanks so much for taking the time to speak with us this evening, and we're excited to see as Equa Health continues to grow.
Yeah, thanks for having me, guys.
Thanks, Matt.